Talk about, well, all things health-wise. Martin Gower is a former chairman of an NHS trust and joins us now. Good morning to you, Martin.
Good morning, Julia.
Thanks for joining us. Lots I want to talk to you about. First up, though, the thousands of people, nearly 14,000 people across Britain who have applied for government compensation for alleged harm caused by COVID vaccines, such as strokes and heart attacks. Some people, of course, left severely disabled, lives completely ruined. We know other people will have died, but payments of £120,000 per patient have actually been handed out in 175 cases, but that's a tiny number of those who've applied. But what do you make of the sheer number of people who have applied for compensation for vaccine harms from this one vaccine?
Well, I think it's quite surprising, actually. There's as many as 14,000. When you look at the NHS's own numbers on vaccinations, that suggests that in people under 60, I think only 1 in 50,000 have been impacted, and if they're over 60, 1 in 100,000.
But wait a minute, but where do they get their figures from? Because when I did a yellow card report. Was it the yellow card report where you know, from a vaccine reaction, and you know, the GP kind of just basically completely ignored my request to have that registered, and I know that's happened to other people.
Well, those numbers that I've just quoted are logged on the NHS England website quite publicly. That is, of course, England.
No, but it's how they compile those numbers in the first place. If they don't ask people, then they won't know about people's harms. And lots of people had harms but didn't know it was related to COVID.
Well, because they've come up with quite round numbers, I suspect there's a degree of sampling in there. Because obviously there are, I think it's probable that there's quite a lot of these claims that are not supportable. Indeed, I think just the sheer numbers, it's less than 2% that have actually, of the claims that have been made and have been reviewed, have actually been people have had their award of their 120.
But that may just be the bureaucratic wrangling takes an awfully long time. Look, we've seen in other cases. But in terms of like the number of vaccine harms that, of course, I mean, this totally dwarfs anything else, and that's because everybody had this vaccine. But of course, also, you know, very, very many healthy people. I was very much in favour of the vaccine at the time. Thought, well, this is the route out of things. But again, it was very, very clear that it hadn't been made. You know, it wasn't aimed at being given to younger people who didn't need it, who weren't at risk from COVID, and it was, and then people had vaccine harms, but a lot of people feel, you know, they weren't given full information because we weren't given full information. But let's talk about something else in relation to this, because there's actually been a very interesting health ombudsman spokesperson, Rebecca Hilsenrath. She's warned that no organisation should be beyond constructive criticism, and that clapping for the NHS during the COVID pandemic may have been dangerous because effectively it turned the NHS into a national religion, probably even more than it was. Do you agree?
I absolutely agree. The NHS has been a national religion. I think if you look logically at people's experience in the NHS, they judge by the local service they've received from their GP. And in some places it's pretty good, and in some places it's awful. And really that's where we're at the moment. When it comes down to simplifying that, it's not just about waiting lists and all the rest. Ultimately, we have a problem with health outcomes. And I have a graph that I use in a presentation I give on the NHS, where we finish out of all the OECD countries next to bottom. Only the United States is worse than us.
Yeah, and they spend 3 times as much. Again, no one should ever want the American system. It's terrible, unless you're very rich, when it's very good. But this is it. When we talk about health outcomes, as if it's sort of some sort of weird sort of productivity thing, it's whether or not they've made you better and kept you alive or not. That's what a health outcome is about.
And we have a 69 out of 100,000 actually don't get a good outcome.
Yeah.
They don't properly recover from strokes, heart attacks.
And if they were living in France or even in Romania, they probably would, because they've got better healthcare systems. And that is one of the key things.
Sorry, Julie, I can tell you that in France it's 46 out of 100,000.
Yeah.
So vastly better than we are.
Yeah.
And a lot of people on the left will say, oh, we haven't resourced the NHS properly. No, we have resourced the NHS properly. There's a lot of wastage. There's far too much bureaucracy. And really, if Mr. Streeting is serious about reforming the NHS, he has to look at how it's done in other countries.
Yeah.
Similar to us.
Yeah, and we also have to stop from making this ridiculous situation where people are talking about, oh, the NHS best in the world. I mean, on no metric is it the best in the world. But also this idea that in every other country that, you know, poor people don't get health care. I mean, most people are living in cloud cuckoo land and being so grateful that a doctor or nurse gave you treatment. A, that's their job. They're paid to do that. And B, that would happen in any other country. And people, we think we're sort of this island nation where uniquely people can get health care, as if everyone else is just sort of, you know, something, they get ill and they just die. It's quite bizarre, isn't it?
And what comes out of a lot of this is that the National Health Service becomes a national illness service, and they're not very good at illness, but they're not very good either at health. We have a high level of obese people.
Yeah,
we're not quite as bad as Germany or Australia for obese people, but actually America, of course, 40% of the population are obese, and therefore that's one of the causes.
It is a big factor, isn't it? It is there, but there's so much more to talk about there. But I will have to leave it there. Martin Gower, former chairman of an NHS trust. Thank you for that, Claire.